on compassionate grounds.
8 years ago, Warren Kotler was told he had 3 to 5 years to live. The diagnosis, stage 4 breast cancer, a rare illness among men.
So there's letrozole, Ibrance.
Thanks to a cocktail of drug treatments and radiation therapy, he's outlived the prognosis.
Stick around long enough, there's new drugs that are going to be coming online, and hopefully those will be of benefit.
A month and a half ago, his oncologist did recommend a new drug, TrueCap, which could hold off the cancer growing for several months. The problem, it's prohibitively expensive. The drug manufacturer could cover the cost on compassionate grounds, but says it can't because Health Canada has only approved the drug for women, not men.
I'm being denied access to a drug that might have a benefit to me.
In the United States and the European Union, the drug has been approved for men and women. Health Canada says too few men were involved in the clinical study to draw conclusions. And for those limited number of men, the drug appeared to stop the cancer from getting worse for about 2 months. The agency is also worried about side effects like diarrhea and rash.
It's definitely an effective option.
Warren's oncologist thinks it could still help.
The disease biology is very similar in men and women. We know that many of our treatments we give are equally effective.
Because the disease is so unusual in men, it could take years to gather the same amount of data as for women, and waiting could mean life or death for some patients.
You just have to go with the data that you have and use some common sense and scientific reasoning. And then
Some are calling for more flexibility, even as Health Canada balances risk and benefit.
they don't want to expose anyone to undue toxicity. On the other hand, we're at a point where we want more access to better drugs that will help people, and that's very urgent.
An urgency Warren knows too well.
Life is great. I need to continue. I have a lot to do. I have a big list.
Jennifer Yoon, CBC News, Toronto.